or somebody who takes care of somebody with spina bifida. Nope. Oh no. Alan, how do I make it go to the next slide?
Are you on the PDF or the Google Slides?
On the Google Slides.
Can you click your mouse on it?
I am.
What about the arrows?
There we go. Just kidding. You just had to click on a few other things.
All right, you're doing great.
Thanks. Okay. Okay, now that that's out of the way. So, yep, my name's Christina Kennedy. I'm a student of PT at CU Anschutz. During today's lecture, we're just going to go over what physical therapy is, what the role of physical therapy might be in your care or your loved one's care, some of the different levels of function, some of the factors that might impact your ability to move, your mobility, some different approaches to physical therapy, how this might impact your transition to adult care, and everybody's favorite thing, we're going to go over some exercises. So, what is physical therapy? Not sure how many of you know what physical therapy even is, but PT is a member of the healthcare team just as much as your physician or your surgeon, your mental health provider. We're all a part of your healthcare team. PT is just the profession that helps you to move a little bit better. We call ourselves the movement experts. And one of the big things that we do is hopefully improving your quality of life through prescribed exercises, some hands-on care, and educating both the patient and the family members of patients. We can work in places like hospitals, outpatient clinics, come to your home, see you in your schools, nursing homes, you name it. These are just some lovely pictures of where PTs might be found. So either with tiny, cute little babies or in a hospital, working with athletes, all of it. For a lot of you, PT means that we play a really important role in helping you to gain and keep mobility throughout all stages of your life. As we are all aware of, when we grow up and age, our bodies change a lot. And sometimes those changes come with little aches and pains, and that's where PT can come in handy. So how does PT play a role in your care? There are a few different settings that PT plays a role in. One of those roles is in the hospital. So whether you're in the hospital because of a surgery or not, if you're there for a surgery, PT plays an important role both before and after your care, making sure you can get up and out of those wildly uncomfortable hospital beds. We help to maintain some spinal integrity and alignment, and also play a really big role in skin care, which is not something that I knew PT really did until I worked in a hospital, but PTs do help a lot with wound care and wound care management. So making sure that we're monitoring sensation, how much you can feel, monitoring for pressure ulcers or wounds that happen because of sustaining long periods of pressure on certain areas of your body, like on your sit bones when you're sitting down in a chair for a long time, and helping to just promote that blood flow that helps to heal those areas. Outside of the hospital, PT plays both a preventative and rehabilitative role. So this is where that keeping you healthy and happy and at home is really important. We want you to stay at home as much as you want to stay at home. So that comes in the form of helping with adaptive equipment. So things like your wheelchairs or, like your ankle braces or crutches, canes, walkers, all of that stuff falls into that umbrella of adaptive equipment. And again, helping with that patient and family education. Another really wonderful role of physical therapy is that we help to follow patients throughout their entire lifetime. The clinic that I'm currently doing a clinical rotation at, they've got patients who've been coming to that clinic for 10 plus years for different aches and pains. And so that's where PT can really play an important role in making sure that we can help you throughout all of your stages of life. PT helps to take an in-depth understanding of your individual circumstances and helps to create a plan of care that keeps your goals, your mobility level, your current function, the things that you want out of therapy at the center. We create those goals with what you want out of PT. So some functional abilities by level. Our spine is divided up into these different areas. So the top part is the cervical area. So that's your neck. Thoracic area, that's your middle back. Lumbar and sacral, that's your low back. And these different areas of your spine impact some of your functional abilities. So for somebody who might have a thoracic level of lesion, might require a little bit more of that adaptive equipment that we talked about. So using things like an HKAFO, which just means hip, knee, ankle, and foot orthotic. Somebody who has a thoracic level of lesion might start to be standing by a year to a year and a half of age. And they can also do stuff like start wheelchair training as early as a year old. I don't know about you, but seeing a 1-year-old in a wheelchair might be an interesting thought. And so that's where PT can come in handy too. Using a wheelchair definitely is a skill. And so learning how to use that wheelchair both in your home and in your community is really important. For somebody who has a lower thoracic or a lumbar lesion, so that lower part of your back, might not require as hefty of adaptive equipment, but still might require some. And then for people who have a lower lumbar or a sacral lesion, may not require any bracing, but could benefit from stuff like an ankle foot orthosis or GRAFO, which is a ground reaction AFO. That just means it gives you a little bit more pep in your step, helps you with a little extra spring. This is just a little graph that helps understand what certain levels of your spine help to innervate some certain muscles. These are all a lot of really big words for certain muscles. So we can just look at a few. So for L5, it shows us which muscles might be innervated by the L5 spinal segment. So semimembranosus and semitendinosus, those are your hamstring muscles. So if you have a lesion at the L5 level, muscles like your hamstring muscles might be impacted. They might not work as well as they could. Things like your extensor hallucis longus, that's the muscle that helps you bring your big toe up off of the ground. So things like maybe lifting your foot up when you're walking might be a little bit more difficult. So this graph just helps us to understand which muscles might be impacted. And then we can take that and look at something like this. Similarly, looking at maybe more of the level of the spinal cord that's impacted and some of the motor function. And then what might we do about it? So again, if we stick to that L5 area, one of the things that might be impacted is having weak toe activity. So like I said on the last slide, being able to bring your big toe up off the ground. So if you have difficulty bringing your big toe up off the ground, what might be beneficial is having stuff like the ankle foot orthosis that helps lock your foot in a place so that you're not dragging your toes on the ground. Then this graph just helps us to understand what the functional ability might be. So somebody with an L5 lesion will likely be able to move around in their house and in the community. They just might require some of those assistive devices like crutches or even maybe a wheelchair. Now, this is a huge blanket statement, and obviously this is different from person to person. So this is just a big statement about the averages of people who have lesions at these levels. So when we're taking into consideration all of your ability to move based on your lesion, based on different areas of your health, we also, as a physical therapist, want to consider things that might factor into your ambulation decline or your ability, or what might make you move a little less So that might include things like obesity, musculoskeletal complications, which just means difficulties with your muscles and with your bones, and your skin breakdown, which we touched on a little bit. So with obesity, children with spina bifida who primarily use wheelchairs use less energy and might have a harder time burning calories. Where PT comes into the picture is helping you to understand how you might be able to maximize your mobility and help you reach some of those more physical activity guideline goals. For somebody who maybe has a harder time with energy expenditure, doing things like your activities of daily living, like brushing your teeth, getting up out of bed, getting dressed. If that's really, really taxing for you, that's also where PT can come in and help you to understand what kind of assistive devices you can use to save energy so that you're not using all of your energy on things that you shouldn't have to use all of your energy on. One of the things that we know is that less functional mobility in childhood can impact adulthood. So this just means that staying active is really important, and staying active consistently is really important. And doing that in whatever capacity that might look like for you. So just making sure that you're staying consistent and staying communicative with your healthcare providers. Some of the musculoskeletal complications that can impact your ability to move are some of these issues that might occur at the spine. So scoliosis, people with spina bifida are at higher risk for developing scoliosis. And that just means that you have poor alignment of your spine. You get a little curvature in your spine, and that can make it difficult and painful to move. And physical therapy can help you to prevent the progression of your scoliosis curve, and also to help rehab from some of the aches and pains that you might get from scoliosis. You can get certain injuries that can occur at both the feet, the hip, and the knees. So at the hip, things like subluxation, which just means dislocation. So your hips can pop out of their sockets, or fractures that might be related to weaker bones. These are all things that will be obviously monitored by your healthcare team. And then we can get complications at the feet and at the knees. Contracture just means that muscles tighten up more than we would want them to, which makes it a lot more difficult to stretch and to move and to strengthen muscles. So that's something that's really important that physical therapy will help you to prevent. And if it is something that does develop, they will help you to manage. And then skin breakdown. These are areas that if you are somebody who uses a wheelchair a lot, you're sitting down quite a bit. And so you're putting a lot of pressure on things like your sit bones and on your feet and on your ankles. And putting a lot of increased pressure on them does put your skin at risk for breakdown and then for wounds. So it's important to keep these areas clean and checked frequently. So in terms of this prevention management, in order to prevent a lot of these things that might limit your ability to move, is one of the biggest things is just to be able to follow the national guidelines for activity as closely as possible. The Spina Bifida Association encourages every individual to follow those national guidelines as closely as they can, of course, unless a medical professional deems it unsafe for you to do. So some of the benefits of physical activity, there are quite a bit. Physical activity in all forms has quite a lot of benefits for you, both physically and mentally. In the long term, being consistent with physical activity can help to lower your rate of heart disease, depression, type 2 diabetes, and stroke. For a lot of you, that might not mean anything right now, but it might mean a lot of things in 30 years from now. So it just means that we're keeping the whole system a lot healthier, preventing really serious illness from happening in the future. Doing things like physical activity consistently can help us to stay strong, stay fit. And that has a huge impact on your ability to stay independent. Maintaining independence is a really huge goal for a lot of people, and especially in physical therapy. And preventing the loss of strength and fitness can have an impact on independence and your ability to do the daily activities like getting dressed, going to the bathroom, all of those things. And then physical activity also has a lot of benefits for your mental health. People who exercise frequently have better perceived physical appearance, greater self-worth, and higher quality of life. So some of the recommendations for physical activity for children ages 6 to age 17 are to get 60 minutes or more per day, mostly of aerobic activity. Now, that does not mean that you need to be going to the gym for 1 hour every single day and lifting heavy weights. This can mean something like walking to the grocery store, walking around the grocery store, playing basketball, going for a swim, going to yoga, walking to school, walking around in school. All these things can count as that 60 minutes or more. It just means that at some point you're getting your heart rate up a little bit. Doesn't have to be anything crazy. They also recommend for children ages 6 to 17 to do muscle strength at least 3 times per day. And that's something that if you are currently in physical therapy, hopefully they're giving you some guidelines on how to get some muscle strength. And that's something that we'll talk about in a little bit. For adults, there are substantial health benefits seen at that 2.5 hours or more a week of moderate intensity exercise. So when we talk about this interdisciplinary approach to care, what that means is that we're talking about who your team members are who are helping to work with you to keep you healthy, happy, safe, at home, and independent. This team can be much more than what's listed here, but there's a lot of people listed here. So physical therapy typically is in a rehabilitative team that includes physical therapy, occupational therapy or OT, and speech therapy. The 3 of us typically work together, but we can also collaborate with your physicians, your surgeons, nutritionists, your mental health provider, your social worker. All of these people all collaborate together and work together to help you achieve your goals. That is really important when considering the transition to adult care. So the primary goal with transitioning from adolescent care to adult care is to maximize that lifelong function and maintaining the quality and developmentally appropriate healthcare. And that's something that is really worked on with that interdisciplinary approach, making sure that all of the team members are on the same page and that we are keeping the goals of the patient at the center. So the transition to adult care typically happens between the ages of 18 to 21, but we can start planning for this transition as early as age 12. That's according to the Spina Bifida Association. So it might be different from person to person based on what the goals are of your healthcare team. Setting goals for adult independence helps to guide the transition to adult care. So this means that it's important to have the lifelong and consistent assessment and interventions that help to maximize the chronic condition management. So because we have to carry care out throughout the entire life, we need to make sure that we're, again, all on the same page, looking at things like family function, how you operate in society, the cognitive function and academic performance, how you perform in school, mental health, self-care, and quality of life. All of these things are really important when we consider how we transition from childhood care to adult care. When we look more at the physical therapy side of things, the gaining and keeping mobility, some of it can be pretty simple, just looking at things like stretches and strengthening. Gaining and keeping mobility can mean staying active in your home, in your community, doing things like fun activities that bring you joy, that you enjoy doing. This can also mean focusing on your goals and making sure that you are as independent as you can be and as you want to be. So now for everybody's favorite activities, we're going to go over some exercises. I want to just make a quick little disclaimer that the exercises that we're going to go over are a pretty broad and blanket statement on, we're going to be going over good posture. Many of you maybe already attend physical therapy or have a loved one in physical therapy, where a doctor of physical therapy has created an individualized plan and prescribed interventions that best support your needs. So please understand that the things that we are going over are not something that you should listen to over the word of your current physical therapist. Just want everybody to know that. So some of the things that we're going to be going over today are posture, our posture awareness, our breathing, flexibility. Other physical therapy interventions can include patient education that we've talked about, strength, mobility, all of these things. So in terms of our breathing, we're going to be going over something called the Mary Massery soda can model. Now, if anybody has a nice, oh, there we go, it's not blurred. I'm not a big soda drinker, but I am an avid Spindrift drinker. So if anybody has a Spindrift can or soda can, you can grab it. We're going to be doing a silly little activity with that. This Mary Massery soda can model goes over the integration between the cardiopulmonary function, so how your heart and your lungs work together, your breathing mechanics, just means how you breathe, and your postural control, how we can maintain our bodies upright, and how all of that works together to help you to breathe better. We're also going to go over how some of those breathing techniques can work to improve how your ribs are moving, how the strength of your diaphragm, and how your heart is working and how to make it more efficient. We're going to go over some strength and flexibility exercises and how those impact your ability to breathe. So this soda can model that I talked about, the soda can, soda pop, not really sure, but what this talks about is that the soda can resembles like our upper half. So the top of the soda can is like our vocal cords, where air enters into our body. My Spindrift bottle is ever so conveniently laid out. So the white part is going to mimic the thoracic cavity. This line here, that's where our diaphragm lives. And our diaphragm separates the thoracic cavity, so where your lungs are, from your abdominal cavity. And then the bottom is where your pelvic floor is. So this soda can model goes over how having really good posture, where everything is stacked right on top of each other, can provide us with the most support and where we can maximize our breathing techniques. So things like, let me see. Oh dear. Now I'm not sure what I just did. I need to go back. There we go. We're good. Not really tech savvy with the Zoom presentations. Okay. So going back, how do you think that poor posture might impact your breathing? In turn, how do you think that improved breathing might impact your posture? This picture over here goes over some of the muscles that are represented by this soda can model. So we've got your vocal cords up at the top. In the front of your body, that's where your abdominals live, your six-pack muscles, the muscles that line your spine. Some of them are called your multifidi. Those are really responsible for a lot of the stability that lives in between each spinal segment. Your diaphragm is a muscle that is responsible for a lot of breathing, and then your pelvic floor. So what this model goes over, again, like I said, is when everything is stacked right on top of each other, that's when we have the most stability. So when this can is upright, nothing's crinkled, I can't really mush it. It's not happening. So what that means, that's showing that our head is directly over our shoulders are directly over our pelvis. We're sitting equally through each one of our sit bones. So when you're sitting there in your chair, you can feel each one of your sit bones equally. Now, most of us probably don't have that whole head over shoulders posture, the whole thing, guess they call it texting neck now. I don't know, but I know what we want. The ideal posture is for your ears to be directly over your shoulders. And mine certainly don't live there normally. So you do a little check. If you put your pointer fingers on your ears and then try to get your thumbs to your shoulders. Are your pointer fingers directly in line with your thumbs? Mine aren't. So we got to bring our head back. That's where we get this idea of maximal stability. We're maximizing our posture to maximize our breathing. So the opposite, if we sit with really, really, really bad posture, we slump forward. Now, if everybody slumps forward, takes a really, really big deep breath in, kind of hard to do. If you sit back upright with really good posture, take a big deep breath in, a lot easier to do. The same thing can be mimicked with our lovely Spindrift bottle. So sitting upright, lots of stability. But if I crinkle this, this is supposed to mimic having really bad posture, really easy for me to crinkle it. So now we'll go over why that's important. So the importance of diaphragmatic breathing. Not sure how many of you know what diaphragmatic breathing means. So to start, I want everybody to put one hand on your chest and one hand on your belly. And take a really big deep breath in. What should happen is we should feel our belly hand moving more than our chest hand, but oftentimes that's not what happens. So when our belly hand is moving more than our chest hand, that means that our diaphragm is the one that's moving the most amount of air into our lungs. When our diaphragm is moving the most, that means that we're maximizing our space in our lungs rather than just using, they're called our accessory breathing muscles, which are the chest muscles. So our diaphragm plays a really important role in our breathing and also in our posture, as we mimicked with my lovely Spindrift bottle. So our diaphragm strength is impacted by our posture. When we slumped forward and took a really deep breath in, I don't know about you guys, but it was kind of painful for me. And that's what that means, is that our diaphragm isn't able to use all of its strength if we have poor posture. If we sustain poor posture for a long period of time, that can cause things like back pain, neck pain, shallow breathing. So we're using our chest muscles more than we're using our belly, and breathing dysfunction, which can have a whole host of implications long-term. So everything is related to our pressures that our diaphragm is responsible for regulating. The diaphragm is the body's major pressure regulator, and we can help to optimize it by improving our posture. If someone is weak, that impacts their ability to regulate their internal pressures. So that means if you have a really hard time holding yourself upright in that ideal posture that we went over just a second ago, that means that it can be really hard for you to breathe correctly, using your diaphragm correctly and most effectively. Things that poor posture does for us or doesn't do for us. When we sit with poor posture, we're bringing the base of our ribs closer to our pelvis. So that's that slumped posture. And that makes the movement of the, movement of the diaphragm harder. And this leads to reduced lung capacity and reduced inspiratory flow. So this pressure creates functional strength, and our trunk is similarly structured to the soda can, bringing it all around. So posture and breathing, what's the relationship? We've kind of touched on that a little bit. So the muscles of respiration, the muscles that are responsible for breathing, are also the muscles that are postural support. Obviously, if you just had a skeleton, it wouldn't be able to stand up by itself. We need our muscles in order to keep ourselves upright. So both the outside and inside forces that impact our function of breathing also impact our ability to maintain good posture. Our body relies on the support of our muscles to counteract the forces that are outside of our body, like gravity. The diaphragm, that muscle that we talked about, that separates your thoracic cavity from your abdominal cavity and is responsible for a lot of your breathing, is dependent on the support of the intercostals and abdominal muscles, which just means those are the muscles that live in between your ribs and like your six-pack muscles. And those are really helpful for maintaining that consistent pressure control throughout the abdominal and thoracic cavities. Poor posture compresses the thoracic region and does not allow the diaphragm to expand fully. Again, going back to when we sat with slumped posture, it's a lot harder for us to take a big, deep breath in. And that limits the amount of lung expansion. So we're not getting as much air into our lungs as we could get. What can we do about this? Well, there are two things that we can do primarily. One, we can be aware of when our posture is at the worst. For myself, it's when I'm sitting on my couch scrolling through Instagram, or when I'm on my computer studying for hours on end. That's when my posture is the worst. Maybe it's when yours is too. The second thing that we can do is being aware of why our posture is lacking. Now, that awareness part is where a PT comes in. A PT will help to assess maybe why, if you have tight muscles, weak muscles, how we might be able to get you some adaptive equipment that might help you to maintain better posture. This picture over here shows like a very generic theory in why somebody might have, we call it the forward head, rounded shoulder posture. So that texting neck posture from a little bit ago. That just means that, again, here in this image, this skeleton, this body's ear is not directly over the shoulders. The shoulders are rounded forward, kind of in that slumped position. Now, this theory talks about how you can have this like crossed theory of tight muscles to weak muscles. So tight muscles in your upper traps and your pectoralis muscles. So the muscles that are right along your neck and in your chest. And then weak muscles that are in your neck, the ones that are responsible for keeping your head in that nice tucked position. And in, oh, no, go away. Oh dear. Okay. And in your shoulder blades, the muscles that are responsible for keeping your shoulder blades in that nice ideal position. So now we can get into some of the exercises that we kind of talked about. Again, these ones are just like the generic, everybody might benefit from these to improve your posture. So some of the stretches that are just globally good for posture are a doorway stretch, thoracic mobility, and upper trap stretch. So all of these here, we have pictures of these. So this first one is the doorway stretch. And that one is the one that helps to open up that pectoralis minor muscle. That one lives right here in your, in the front of your chest. If you find your collarbone, come right down from it, you'll probably have a nice tight and sensitive muscle. So that's your pectoralis minor. When that one's really tight, that's when we start to get that rounded shoulders. It makes it really difficult for us to maintain nice open chest, which if that muscle is really tight and it's difficult for you and kind of painful for you to maintain this open chest, of course, you're not going to be able to do that for a long period of time. So this doorway stretch here, we've got a few ways that we can do it. So this first one up here, you put your arm up on a doorway and you lean into it, and you should feel the muscle right here. Doesn't have to be anything crazy. You can also do it sitting down, again, just making sure that that arm is behind you and you're getting a stretch right here. The second one that we can do is called thoracic mobility. So if you remember from back at the beginning, your thoracic spine, that's that middle part of your back. And our thoracic spine is responsible for quite a lot, but it could also get really, really tight in most people, especially people who are sitting down a lot. So what we can do is we can help to do a little bit of thoracic mobility with some exercises. I personally like to do the one where you cross your arms in front of your chest and you do some rotation. So you try to look over your shoulder and then look over your shoulder. And you can do that a few times. You might even get some cracks out of it if your back is tight enough. And then you can do like a back bend. So looking up at the ceiling, coming down, kind of like you're doing a cat-cow. Now, this is just a good one to do to really help open up your back. It just honestly might just feel good. And then the last one that we can do is that upper trap stretch. So if you remember from that last slide, the two muscles that often have a hard time with poor posture are our upper traps and our pectoralis muscles. So our upper trap is the one that lives right along here. And it's also conveniently the one that most people carry a lot of stress in. So it gets tight really easy. So what you can do is you can, like this picture shows right here, you can put one hand underneath your hip, underneath your butt, just to help anchor down that shoulder. Your other hand can come up here on your head and give you a little pull. It does not require a lot for me to get a nice stretch, and you'll feel it right along here in your neck. So these stretches just help to open up your chest, which is that front compartment. It helps to improve our neck posture, which in turn helps to improve our ability to breathe deeper. So I don't know how many of you know what the actual stretching guidelines are, but the guidelines are to hold each stretch for 1 minute a day. That's it, just 60 seconds per muscle. But when I try to stretch, 1 minute feels like a bajillion. So I have to set myself a timer, and I would highly recommend it because, again, 30 seconds can feel like 15 hours when you're trying to stretch. But in order for us to actually see changes in the muscle's length, we do need to be holding the stretches for 1 minute a day. Now, that does not mean that you have to be holding a stretch for 1 minute straight. You can do that however you want to achieve 1 minute is fine. If you want to do 6 times 10 seconds, perfect. If you want to do 2 times 30 seconds, perfect. Whatever feels best for you is good for me, as long as you're doing that 1 minute a day. So now that we've gone over a few stretches, we can go over a few strengthening exercises. So the weak muscles that we talked about in the beginning of the ones that are typically weaker in people who have that forward head, rounded shoulder posture are muscles that are deep in the neck, and then ones that live between our shoulder blades. So there's one exercise that you may or may not be familiar with. It's called a chin tuck. And that's the one that helps us to bring our ear more over our shoulder. So I'm just going to turn like this. So normally, like that forward head posture is when we are here, bringing our head forward. Maybe we're trying to like look down at something and we go like this. So a chin tuck helps us just to lengthen up the back side of our neck, bringing our chin more towards our chest, like you're doing a nod yes. This, again, does not have to be a huge movement. I like to do where I put one hand on the back of my head and one hand on my chin here. And what you're doing is your practice, it's like you have a balloon attached to the top of your head, bringing up the back of your head. So you should feel a nice stretch in the back of your neck. This doesn't have to be a huge thing. The muscles that are responsible for this action are super tiny and they live behind your throat. So it's nothing crazy, but we're just trying to hold this. Now, your PT might have already prescribed you with something like this. So again, abide by whatever guidelines they give you. But the typical recommendation for practicing this is to hold it 10 times a day for 10 seconds. For the muscles that live between our shoulder blades, which are responsible for helping us to maintain that more open chest posture, which helps us to expand our thoracic cavity, we can do something like rows, which is what this person is doing up in the top picture. So doing things like bringing our shoulder blades together. You can do it with weight, you can do it without weight, you can just do it here sitting. So if you're sitting here with your great posture, of course, and you just squeeze your shoulder blades together, pretending like there's a pencil between your shoulder blades and you don't want to drop it. And then you can relax, bringing your shoulder blades together and relax. So those are responsible for a lot of those muscles that do help us with our posture. And of course, we cannot neglect core. Now, when most people think of core, they think of our six-pack muscles, but core means so much more, as we talked about earlier with the soda can model, that there's the ones that live in the front, but also the ones that live in the back. So I worked with a physical therapist who always talked about 360-degree core. Core is never, ever just our six-pack muscles. It's doing things that create stability throughout. So I really like this exercise in this bottom picture where you're sitting on a ball or on your bed, on a wheelchair, anything where you can sit off a little bit, have a little bit less stability, and then doing something where you're pressing weight out, bringing it back in. Anything that just forces that 360-degree core to activate a little bit more and really push that stability. So those are just a few exercises that are good to do. Now, one of the biggest things that I think people don't realize is that strength training can be dosed, just like we dose medication. We as physical therapists dose exercise. So there is a huge difference between dosing something for strength and dosing something for endurance. So when we're dosing something for strength, we're thinking of being able to lift up the biggest, heaviest box when you're helping your friend move, or being able to bicep curl the heaviest weight at the gym. That's what we think of when we think of strength. We're doing it a few times in a row. It's not something that we have to hold for a long time. So some of our strength muscles are a lot different than some of our endurance muscles. Our endurance muscles, so when we think of endurance, think of going for a run. You're going to be running a marathon, not a sprint. You're running for a long period of time. You want to be able to hold the same position for a long period of time. So when we want to dose strength exercises, we want to get to that 3 sets of 8 to 12 repetitions. So that means if you are at your 12th repetition and you're like, man, that was the easiest thing I've ever done, I could do like 5 more. That is way too easy and you need to add more weight. On the flip side, if you get to 6 repetitions and you're like, no way I'm ever going to be able to get to 8, that's way too heavy. You need to lighten it up. So that's our strength range. That's our strength sweet spot. For our endurance gains, for our endurance muscles, we want to be able to do 3 sets of more than 12 repetitions, because our endurance muscles are the ones that we want on all of the time with all of our movement. So that being said, do you think that postural muscles are endurance muscles or strength muscles? I'm not going to force anybody to speak out loud or put anything in the chat. I'll just give you the answer. Our postural muscles and our respiratory muscles, which we learned earlier, those are pretty much the same thing, are our endurance muscles. So those are muscles that we want to really be forcing to work for longer periods of time, because regardless of what you do, whether you're in school or you're out working, we have to be working against gravity for a long period of time, probably longer than you would like to be. So when we're working against gravity for a long period of time, that's an endurance activity. We're doing it for long time. I just said that. So we need to dose all of these exercises to be able to sustain us for a while, right? So instead of just doing 3 sets of 8 chin tucks, we need to be able to hold a chin tuck for a few minutes, doing things like a plank for a few minutes, doing things like our rows. We want to be able to do those a lot. So when you are doing these exercises, if you do these exercises, just keep those things in mind. And that concludes our physical therapy education part of this presentation. Those are my references.